Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and leadership. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. For this episode, my 272nd episode, we have a great show with healthcare thought leader, technologist, and innovator, as well as a longtime friend joining us, Mr. Mike Mosquito. Welcome back to the show, my good friend.
Justin, thank you for having me again. Glad to be back. Glad to be able to conversate with you again.
I love it. We have a big fall coming up. But before we dive into that and some of these cool conferences and some great thought leadership, where are you calling in from, my friend?
Calling in from Hilton Head, Georgia. Hilton Head Island, to be specific. I'm actually at the beach this week, working from the water.
Love it, love it, love it. As you know, I share time in Sarasota, and so I spend a lot of time on the water, along the water, and actually it helps my work environment. Makes me more creative, and obviously we have a lot going on with the very busy and hectic days. So being on the water, and just really helps with thought processes and just I think keeping me more focused. It's not counterintuitive when you actually can focus in and have a relaxed environment. It helps a lot. So
I agree with you there. It's been a very good week of just kind of getting to relax the brain a little bit, actually speak to some customers about some of their long-term strategies in a casual manner because I'm on vacation. So talking to someone this week's a little bit more of a casual nature. And then I just get to lay back and relax in the evenings or get up early in the morning, go enjoy some of that water rolling in.
You got it. And that's actually one of the segments. If we have time, we'll get to it. It's always where I try to end my show is, where do you go with a question to my guests? Where do you go to get or be inspired? And now my actual producers make it its own little segment because it's very inspiring. So mine is usually the water. So actually, you know what? We can start off our show this time with that question. So where do you go, Mike, in general, to go or get or be inspired?
I will tell you, I lean to going towards the water during the summer and the warmer months where I can have a golf course. And I played the other day by myself. It was weird because they were asking, like, don't you want to play with someone? I'm like, no, this is my time. It's my quiet time, my recharge time. I get to think. I'm thinking about one little thing, but then I get to actually that drive between holes, be by myself and recharge myself. And during the winter, I like white snow. I went to school out in Colorado to start with. At the Air Force Academy, and that's why I learned how to use that quiet time in the mountains to recharge, meditate, and get my balance back. And that really does help me. So I have two different points of recharging, winter and summer. And one's the water. I grew up on the water in Mobile, but during the winter, I tend to lean towards white powder and just kind of relax and ski.
Love it. Actually, yeah. I mean, we're similar in that regard. The water is certainly where I like to relax and unwind and recharge. And I grew up skiing. I grew up in the Northeast outside of Boston. So I picked up skiing and ski out West almost every year now. But I didn't realize we had all that in common. Very, very cool. Well, hey, I appreciate you joining me on air because the outline that you sent me, some of your thoughts are just spot on. And so I think that, this is a great show. We have an opportunity to share, not only thought leadership, but also really best practices. This show, now we're going almost into our 10th year. And so it's about highlighting best practices and key strategies to be successful. And now we're about to walk into some really big conferences for the fall. And so I think this is extremely timely. And obviously you're a great thought leader in the industry. I've always enjoyed collaborating with you. We think alike in a lot of ways. And so it's always a fun time, a conversation, or we're sitting at a conference, sitting in Atlanta somewhere, or certainly here on air. You're always a great breath of fresh air to speak with. So let's go ahead and dive right in. And I know you guys really got a cool announcement around an upcoming conference in Georgia. So why don't we talk about that for a second, and then we can talk about some other stuff, and then kind of dive into some really cool thought leadership.
Yeah, next week on the 3rd of October, we start the Georgia HIMSS Conference, actually our Georgia HIMSS Annual Conference. Yep. And we have a great lineup schedule for those attendees, those partners, and those healthcare leaders who are going to be coming down to the Atlanta Waverly and be able to sit back, relax, and enjoy healthcare information technology firsthand from thought leadership and those leaders around the region. We brought in Ed Marks as our headliner to
Love
be
Ed.
able to have Ed's going to be coming in to open up the conference for us. And so we really want to make sure that the panels of CIOs that are going to be closing out the show are going to be thought-provoking and providing some insight to those partners that are looking to bring technologies into healthcare, these new emerging technologies, and be able to offer some insight into what they should be looking at on their strategic roadmap. So next week, Georgia HIMSS on the 3rd. If you can go to georgiahims.com, you'll be able to find the website. You'll be able to find, or you can look me up on LinkedIn, and you'll be able to find links to getting to that conference. But we look forward to having everyone around the region come and join us for Georgia HIMSS annual conference.
You got it. Tuesday, October 3rd. And this is actually going to play and broadcast. We're going to do an encore broadcast as well throughout the week, so we can, publicize the Georgia HIMSS conference. I've supported that, throughout the years, actually probably for over the last decade at least, on the radio show. So it's a great annual conference, a great place. If you're in the Atlanta or even the Southeast area, it pulls from all over. Ed Marks is a great global speaker. Ed's amazing and a longtime friend of all of ours, great friend of the show actually as well. So you're in for a real treat there. And hopefully even if they hear the show after even Tuesday, October 3rd, people can actually just check out the Georgia HIMSS conference webpage, because obviously I'm sure you have a lot of good content posted there on the annual conference. But then also, Georgia HIMSS in general is a great society, because I think they actually in 2020 got Society of the Year. So it's really cool to see to see the all that Georgia is doing with you and others there. Love the team. So congratulations on that. And then certainly Sunday, October 8th starts the health conference out in Las Vegas. I'll be out there broadcasting live as well. So excited for that opportunity. But this show specifically this week is going to be focused on, just again, expertise and best practices that we're going to glean from this conversation and what we've been able to pull together over the last 20, 30 years, looking out over the industry. So, why don't we dive in, Mike? Again, I appreciate you taking the time to join us. And let's get some of your expert opinion. So, and you've done some really cool opinion pieces on this lately, and this is what really brought this show together today. But share your thoughts on a technologist perspective. And really, we're going to, just so to prep my audience, we're going to walk through different, perspectives from technologists, healthcare providers, administrators. What are their roles in healthcare today? Because it's evolved tremendously. And then we're going to spend some time towards the end of the show just going through some best practices around Center for Excellence and Innovation, and also how to collaborate for success. Really key strategies around change management and what we're doing in healthcare today to really get the most out of our environments, give the most to our constituencies, our teams, our patients, our peers. So it's a great action-packed show. But let's dive in right now on the technology side. What's your perspective for technologists and their role in healthcare today, Mike?
Well, a great question, and I will tell you, it depends on the technologist, and if they're on the provider side or they're on the partner side of healthcare, Justin. And I'll tell you, I've been very fortunate to see both sides.
Yep.
Right. Your perspective is based on what you're either delivering or you're having to consume and implement. And so I have a unique role as a technologist, having seen both and played on both sides of that coin and evaluating emerging technologies, developing strategies, guiding internal innovation, that technology is supposed to have a mindset of this is right for the organization. It's right for them to consume and be able to support. And then the consulting technologist that's presenting what their company is either sponsoring or funding that technology to be sold. They must be able to evaluate if it makes sense to introduce that to the health system, I should say. Mm-hmm. And not everything should be sold into healthcare. Not every technology is primed for healthcare. So this includes, on that strategic roadmap, what is the ROI for a health system to invest in this new technology? We all know the buzz around AI. We all know it applies to healthcare. But what use cases are important to healthcare now? How should it be introduced? Where should it be introduced? Because it's not saving doctors from visiting patients. That's not happening yet, right? They're still having to visit patients, diagnose and treat their patients. What happens is our AI is another tool that they have in their belt to be able to use to gather more data and information. So evaluating those challenges and opportunities that technology and technologists face is to determine, is it the right time, right place for that strategy to be developed? And then internally, how do I bring the ROI around that innovation that I brought to the facility?
Absolutely. And the only thing I'll say there in the ROI is track that. This is good for the organization as well as the technologist, is to track that in the vendor, track that from day one. Like when you're going into this implementation, as you know, is, hey, what is the ROI that I should expect in year 1, year 2, year 3, year 4, and year 5, and then track that at least quarterly. Or, you know, maybe it's however long. Every implementation is a little bit differently, but some of the stuff that I do, I try to do quarterly, just to make sure I'm getting the most out of it. But again, that based on what innovation you're deploying and supporting your service. So
that's right.
And
I will tell you, Justin, the collaboration between the technologist and the healthcare provider or administrators is important too, because you can bring, this is the best, newest, and greatest, but if it's not fit in line with the healthcare provider or the administrator's plan for the system, you're going to break more than you're going to attempt to fix.
So true. Wisdom. All right. So you bring up, healthcare providers. So let's talk about that now. So what is the healthcare provider's perspective and their role in healthcare today? I know it's a broad question, but I want to make sure we cover a lot of good ground and some best practices here. So
not a problem. Well, I am very fortunate to have quite a few healthcare providers that I am currently working with. And I'll give you a perspective of a couple of those key ones that are now. One just received an award this past week for being an Innovator of the Year. And it's balancing the current state of the system and its operations while strategically planning to grow internal, external experience. That's internal employee experience and that patient experience. So their perspectives now is kind of pivoted. It was used to be on, big iron. How many servers can I put in my data center? Now it's the experience that that data is there. That data is being aggregated. It's now in the cloud. We've moved to the cloud. Now it's about the perspective for a provider is what experience am I giving to retain my patients, that patient experience, my employees, as we put in these EHR systems, these large technologies that are consuming data that we have to manipulate and understand. What are the experience for those employees as we pivot, as we innovate? Are we keeping that at the top of mind and creating an employee experience, a patient experience that makes sense for your system, for your domain of healthcare? And as a role as a leader of that healthcare, can you create a better patient or employee experience by bringing in new technologies of change management, a consistent engagement model, whether it's internal or external? And that could be for your doctors and your nurses and your technical staff throughout the entire system. Those are your constituent users. So are you taking that constructive feedback and creating these experiences that make sense for your organization? So as we change roles of healthcare providers in this new digital era, this era has to embrace technology. You're enhancing that patient engagement. The care delivery is at a heightened level. It's going to increase as AI and machine learning starts to become more ingrained into our environment. Telemedicine was around for however, but it took a pandemic for it to just take hold overnight. And now everyone's made it part of their employee, their patient experience, right?
Yep. Their care strategy. Absolutely. True. No, and I love how you bring up everybody's experience, the provider's experience, the patient's experience, the team's experience, the organization's experience. Those are all critical pieces, and nobody can be left out of the equation because it'll break, like you said, it'll break more than it fixes. So we've got to make sure that you get that integrated and holistic approach.
I will tell you, Justin, outside of healthcare, other industries have really taken hold of this experience transformation. Centers and these challenges brought on by understanding these experiences help integrate these new technologies faster, better, and with better support from internal staff. Better workflows are created.
Love it. So, now taking off on that, that internal staff, in the teams there, what's the healthcare administrator's perspective and their role in healthcare today?
So I'll say fostering innovation and excellence, right? That administrator is supposed to be able to look and say, hey, I've seen what our competition's doing downstream. We want to bring on innovation and excellence. We've got to be able to identify what areas of improvement or potential disruptions can our facility have within our area. And as we're growing, as hospitals acquire other systems and they start growing their footprint within their region, how do I use this innovation to develop a culture of innovation and continuous improvement? And that improvement could be, again, internal, your internal operations, your internal staff, the employees, and it could be continuous improvement for how I touch my patient population. And that could be within a major metropolis, or it could be in rural areas of care. How do I continuously improve that engagement model using this innovation and technology and areas of improvement around the system? So I say leveraging centers of excellence for specialized expertise and being able to put a central repository of information and personnel together, leverage that around creating this fostered innovation environment that provides an excellent host for growing your system, balancing what you have for what's on site for your strategy and what innovative solutions have you seen that have transformed other facilities. How can you take hold of those? You may not be a leader in innovating technology, and most healthcare systems aren't. They're more of a laggard. They're going to wait and see what's going to happen, right? That's not what we do in healthcare.
Mm-hmm.
But once you've seen that proven business case and use case,
yep.
How do you innovate and foster that innovation inside your health system? That's what an administrator should be doing today.
Yeah, and I completely agree, and it's really cool to see some of those leadership organizations, the kind of top 1, 2, 3, 4, 5%. They highlight a lot of innovation. Their C-suite are global speakers on highlighting their centers of excellence, or how do you bring those best practices into your organizations, and a lot of those are our peers. You and I are friends with a lot of those people that do that.
Yes.
So it's cool to see that they share openly. And so, yeah, we need to be there on the other side, making sure that we're capturing what they're saying, capturing their best practices and their key strategies to success. And obviously, every environment's a little bit different, but there's always something that we can take back to our organizations. I mean, I used to travel all around the world looking at best practices. Even went to Cuba to look at how, they have the lowest infant mortality rate. And we have one of the highest here in America, when you look at industrialized nations. So it's, what can we learn maybe from like a Cuba, in what they do. And they basically, they surround that mother with care during the 9 months of her pregnancy, and they can go into a home at any point during the 9 months. She gets 3 square meals a day. So they really support that mother and child. And those, again, bring those best practices. They also do community care much differently than we do, where, one provider takes care of 1,000 people in a community, or maybe 2,000 people in a community, depending upon which community. But anyhow, so they keep their cost of care way down, and the doctor knows everybody. I mean, say, how does he know 1,000 people? Well, they do, and they manage that. So anyhow, there are best practices globally that we can look at, and obviously here as people share those. And for those,
we'll see that 1 to 5%, Justin. I think next week at Health, you'll see those healthcare systems, right? That's where we're going to see and talk to our friends about what they've been doing over the past year. That have propelled their institutions forward using innovation and this new thought leadership around excellence.
Yep. And you're going to even see it at the Georgia HIMSS conference, because Ed Marks comes from Cleveland Clinic. He's a CIO at Cleveland Clinic. And so you'll hear, and Ed would speak about their best practices for sure. And just those who tuned in a little late today, my special guest is Mike Mosquito. And as my audience knows, Mike is a longstanding industry technologist and innovator for emerging solutions. So let's keep the theme going here on the Centers of Excellence and for Excellence. So please share some of your thoughts and best practices regarding those centers, Centers of Excellence or Centers of Innovation in healthcare today.
So first, the hospital needs to understand, and that's top down from your leadership, what a concept of a Center of Excellence. What does it mean for you? What are you looking to achieve? If you look at a Cleveland Clinic, as we say, or you're looking at a Mayo that have Centers of Excellence, what are they doing that's specific to propelling them and keeping them on a main stage in the light of forward-thinking healthcare and innovation? And then the role of that Center of Excellence in advancing the technology and services that you're going to offer to your community. What does that center do? Does it aggregate this technology? Do you put a SWAT team together? They evaluate, they build a strategy, they help implement and deploy. Then they have change management and support that pulls it together and continues to proliferate it throughout all of your institutional assets. And then how do you look at those best practices that are outside your institution today that you'd like to bring in? And how do you establish and manage this COE? Is it with your smartest and brightest from each department that are handpicked, and they're going in to actually evaluate? Or are you bringing in an advisor? I'm brought in as an advisor to help institutions evaluate, understand the concept of COE and employee experience and patient experience. So you bring in someone like myself or like you, Justin, and you're sitting down and you're looking at, here's where you are today. Here's what others are doing that are like you. Not, and no two wheels roll alike.
Mm-hmm.
So it's how do we look at your best practices for your institution and for what you're doing, establish a baseline for your center of excellence and what services you can provide, and then what case studies can be built around these implementations in these healthcare organizations like yours, right? So if you're going to mimic someone else that's hitting a home run with their center of excellence, do you have those capabilities or do you need to go get them? Do you have those solutions or strategies? Have they been developed yet before you start this COE path? Because you have to have a strategy, you have to have a support plan, you have to understand what is the end game here. The technology is only a piece of it. You have to have strategy and you have to have support on each side of that bookend. So technology is going to come last, but you got to make sure that once you put a center of excellence together, what are you going to deliver, and can it be delivered above the excellence that you've already set as a bar? Because that's what the COE is there for, is to push the bar up in your organization.
I love it. I love it. Another topic that I want to make sure we touch on, we got about 3.5 minutes here, is collaborating for success. Collaboration is so key. Doesn't matter what you have for technology or the smartest people you've got in the industry, the best care providers. We have got to collaborate as a team, and we're only going to be successful together. So please highlight some of your best practices and thoughts for collaborating for success in healthcare today.
For me, it's what I mentioned earlier. As a technologist, I like going to providers and those administrators and developing a roadmap and strategy. I am very blessed to be able to talk to the industry technology providers. My past at McKesson and Allscripts and Eclipsys put me in a place where I'm able to have conversations with technology providers and bring information back to these systems and break down silos of fostering interdisciplinary teamwork. My job is to bring people together, and from both sides. While I'm an advisor and consultant, I am also a person that fosters that innovation internal to a healthcare environment. I'm a trusted advisor. I consider myself one of those few out there that I can pick up the phone and call an administrator or a technologist, a CIO, a CFO, and a health system, and we can have a very frank conversation.
Yep.
And that collaboration is key, because once you have someone that is on the same page with you, where you can leverage known information, known data, and make an informed decision, then you can walk down a road mapping strategy together. It's much easier because you understand where that person is coming from. So collaborating with them, collaborating with technology leaders and understanding what their mission is very important to being successful with those projects that are being delivered in healthcare. Without that collaboration, then it's let's try this. And that rarely works in healthcare. If you've got a proven business case and use case, it's here's our proof of concept around what we know. And we hope to see those same outcomes. But at the end, we've collaborated on what's been happening in other places. Here are the outcomes. And we're trying to get those same collaborative outcomes for our health system.
Okay. No, that's awesome. I love it. We have about 1 minute left or so. So let's talk about some future trends and innovations in healthcare. What do you see out there, and maybe a lightning round of 60 seconds or so?
I'll tell you, as we talk about what's happening with AI and potential impact with machine learning, it's going to push the envelope. We're going to be able to aggregate data globally around care and care regimens. If you're going in for a treatment, you're going to be able to look at cases that are global now, just not in your community or what that doctor can see based on what his optics are inside his health system. You'll be able to pull in data from all over with like physicians who are doing those same procedures. This changes the whole landscape of healthcare. And these advancements around precision medicine, genomics, what's been happening over in Europe for now over 10 years. But most people don't know what Epic's been doing overseas for 10 years now, 10 years or longer, around genomics. when I was at McKesson a decade or two decades ago,
Mhm.
this was really about how do you take a populace, gather this information, understand what this population is going through based on their food, their workout, their environment around them. And then how do we change that based on what we know, put it in a database, reference it, and be able to pinpoint here's where things start to change in our environment for care, and be able to predict the future
Mm.
using these technologies and these data points. So as we start talking about innovations around healthcare and future trends, it will be to gather data and eliminate data biases. How do you eliminate these data biases for around the determinants of care? The social determinants of care is one of the main downfalls of our society, where people aren't getting this care. But how do we predict the future of healthcare using technology and understand where this technology is taking us?
Right.
And it's
I
be able
love
to.
it. Yeah. No, you're right. You're spot on. And actually, Halamka was on here talking about that, a couple of months ago. But we are actually at time, Mike. So why don't we? And obviously we'll do a follow-up show. But my friend, so great to have you on air. Thank you so much for joining us.
Thank you, Justin.
You got it, my friend. And thank you, everybody, for taking time out of your busy schedules to join us. If you missed any of this episode or want to hear more, you can always tune in at 2:30 p.m. Eastern, 11:30 a.m. Pacific each day, Monday through Friday. You can also track us on Twitter at HIT Advisor and use the hashtag ThisJustinRadio so we can respond to your comments from the show. If you missed any of this episode or want to hear more as well, you can also go to Apple iTunes, SoundCloud, iHeartRadio, and tune in. And you can check out some of the new content that we're posting out on justinbarnes.com for the fall. Thanks, everyone, and stay safe.